Okay, good afternoon, everybody. So wonderful to see you all. We've reached the end of the week, which is Friday, and we have really a good webinar today. This webinar is a joint webinar between the Disability Members Standing Committee along with the Black Members Standing Committee. This hasn't been done before, so we're really excited about this. We have some great speakers who are going to be speaking to you. As our normal outline in the way we would do things, I'm going to give each of the speakers 5 minutes to say, give themselves an introduction about who they are. And then we're going to go on to some of the questions which you have raised prior to the actual seminar, the webinar itself. And what I think is really important is that bringing together the Black and disabled staff network committees, it shows that UCU is starting to understand the terminology around intersectional and how when somebody has a disability, they also could be impounded by being a Black member as well, or from one of the other committees, it could be LGBTQI, or it could be somebody who's a woman. So all of those compound of what is going on with disability. So I'm your chair for the afternoon, for the hour, and I'm sure that we will have a really good, lively and active discussion. So without further ado, what I'm going to say is I'm going to introduce, I'm going to give the microphone to Alex. Alex, you have 5 minutes to introduce yourself, and I will give you 1 minute to round up before your 5 minutes finishes. Okay.
Thanks, Victoria. So I'm the Health and Safety Official for UCU. I sit within the UCU Bargaining and Negotiations team, and we've recently put out some guidance for Black members and disabled staff who obviously are impacted greatly by the COVID-19 pandemic. And so I suppose today I just want to really touch upon some issues initially. So the health and safety legislation as a whole is obviously become quite prominent during this health crisis, but it's not the only means of tackling the unequal impact felt by both disabled members and Black members within UCU. And the Equality Act obviously offers protection from discrimination and places various duties on employers, but the health and safety legislation as well does place key duties on employers, which they should follow in relation to Black and disabled staff. So one of the main duties on employers is to provide a safe working environment for employees and all others who come into contact with their business undertaking. As part of that, they need to produce suitable and sufficient risk assessments. And that means that they have to identify all the hazards and the risks, and they have to take preventative and precautionary measures to prevent people from coming to harm. Where they can't prevent the harm, they need to mitigate the risks to low levels. And so that should apply to all groups in the organisation. So what we see with many employers is that they've taken the initial step during the pandemic to create a generic COVID-19 risk assessment. Now, the idea of that was to capture all the common hazards and risks that could be felt by staff across the organisation and others, and to control those risks to as low a level as is reasonably practicable. And in doing so, they have to follow what's referred to in the legislation as a preventative approach, often referred to as a hierarchy of control. So that means that they have to start by first trying to avoid or eliminate the risks and then move on to mitigation. And there's various stages of mitigation and control measures that you can implement. And the final stage, of course, is PPE, so protecting individuals from harm using protective equipment. Now, as well as producing the generic COVID-19 risk assessments, many employers also move to produce specific risk assessments. So they might have made area-specific or activity-specific, departmental related lab work, etc., risk assessments around those activities. And what many employers failed to do was to identify equality issues within their risk assessments, and they were not very sensitive to the issues affecting disabled staff and Black members, for instance. And this is why UCU has produced its separate guidance on these issues to ensure that they are embedded both within generic, specific, and individual risk assessments. So some of the gaps, for example, are around the drivers of this unequal impact, which can be discrimination, stigma, bullying, access to PPE, fear of reporting health and safety issues for the impact that members could face. And there's a number of controls that should be in place to tackle these underlying drivers. And one of the things that was a massive failure was access to reasonable adjustments for disabled staff, both in the home and in the workplace. We have changing working environments on site and off site, and the reasonable adjustments needed to be reviewed or new reasonable adjustments implemented for disabled staff. We had changing working environments, changing ways of working, more working online, and there was a need for more training and support for disabled staff and Black members as well. Now, obviously, this all had a significant impact on mental health and well-being, and there is a lot more that employers can do to manage this as a workplace hazard as well, because stress is a workplace hazard that has to be controlled under the health and safety legislation by employers. So the guidance that we put out for Black members, for example, on risk assessments, it talks about the differences between generic and individual risk assessments and how they interlink. And of course, if equality and if issues facing disabled staff and Black staff are missed out of a generic risk assessment, then the collective approach employers should take to tackling these issues is never going to be addressed. Because by just implementing individual risk assessments, you can only really look at the individual risk factors of those staff. So because I've only got 1 minute left, I'll just quickly move on to the COVID age calculator. So a lot of employers are undertaking individual level risk assessments for staff who are disabled and Black members of staff and other groups like pregnant staff, for example. And they are quantifying the risk using numbers. And the problem with this COVID age calculator is the data is quite new because it comes from the UK since the pandemic began. It's live, it's constantly changing. And the employers may not be refreshing this data, so it needs scrutiny. On top of that, we have these risk assessments will quantify risk using numbers, and then they will assign risk levels to these COVID age calculators. And those risk levels are, of course, subjective. So, something that a union may see as medium risk or high risk, an employer could easily label as medium or low. And so this is why it's really important that union branches get involved in negotiations around these risk assessment templates and making sure that these assessments are capturing all potential risks to individuals. And where those risks are widely felt by more than the individual person, then we need to collectivize that issue and capture it within generic risk assessments. It's really important because it obviously places specific duties on employers under the legislation to take preventative approaches. And so we can get control measures in that lead to better policies and practices in the organisation that tackle discrimination and racism. And we can also look at controls around, for example, making staff who are on precarious contracts permanent, because that is a control measure, given that many disabled staff and Black members are in casualised roles. And of course, there's less chance that you will raise health and safety concerns if you're seen as a problem in the workplace. And so control measures can be quite creative when they tackle the root cause of the risks and the underlying issues. I'm being told that's time, so I'll leave it there and I'll pick up any other issues in the question.
Thank you so much, Alex. That is very formative and a full introduction on yourself. Really appreciate that. We look forward to seeing Alex again later on in the discussion. I'm going to move on to my next person. My next person is Thamisa. And Thamisa, who works in further education. So Thamisa Nichols, I'm going to introduce you now, and you've got 5 minutes. I will let you know
Victoria.
when you have 1 minute at the end.
Okay. Thank you, Victoria, and good afternoon to you all. I am Thamisa Nichols, Vice Chair of the Disabled Standing Members Committee. I am from HE, and I have a visual impairment called visual vertigo. Health and safety at work matters to everyone, and it is certainly an important issue for us as Black disabled workers. I'm referring to people such as African, Asian, and minoritized groups. If Black workers are labeled as a vulnerable group in relation to COVID, then Black disabled workers could be considered to be more vulnerable in these circumstances. Historic racism, poor experiences of health and/or poor experiences at work may mean that we are less likely to seek care when needed or are less likely to speak up when we have concerns about our health and safety. These are only a few things that are unique to us and that can prevent us from managing during these challenging times. While our ableist institutions continue to perceive disabled people to be less valuable and inferior to non-disabled colleagues and define us by our disabilities, the Equality Act 2010 places a duty upon employers to remove physical barriers and or provide extra support wherever reasonable so that we are not put at a disadvantage when compared to non-disabled colleagues. We, therefore, have legitimate concerns about health and safety at work, whether it be working from home or while working on site. The impact of living and working in isolation for some, the increase in stress and anxiety levels due to the demands of home working or commuting to work for others results in the exacerbation of existing health conditions and increased mental health issues for all. The narrative that Black workers somehow have perceived higher risk of contracting COVID due to a perceived or implied genetics weakness has the potential to increase existing inequalities and the levels of discrimination we encounter. Perpetuating such a narrative has far reaching consequences, with the potential for us to become involved in capability procedures, being denied promotion, failing probation, and subsequently losing our jobs or being refused future employment. We are often the ones who are first to become dispensable through compulsory redundancies and be out of employment due to funding cuts. How COVID has impacted us is no secret, and our concern is about becoming lost in the stream of information and or misinformation around our predisposition to COVID. The concerns we had before the pandemic around the systemic inequalities.
Thamisa, sorry to interrupt you. Could you turn it up a little bit? You've gone very quiet.
Sorry about that.
That's better.
The concerns we had before the pandemic around the systemic inequalities and lack of progression of Black workers across the sector is exacerbated and more visible due to COVID. We are concerned about always being asked to share our lived experiences when these are simply used to perpetuate missionary responses rather than as a call to collective action. This is part of the microaggression that we face every day. Winston Morgan argues that everyday discrimination, John Henryism, and the impact that it has on health, rather than genetics and socio-economic factors, are what predisposes us to COVID. We are therefore concerned about the existing relationship between everyday discrimination and the increased likelihood of contracting COVID. We consider commuting to and from work and working on site in shared spaces being unsafe due to having direct contact with public and with students who could be asymptomatic and who are being allowed onto public transport without masks. Returning to a home environment might be very tricky because it is not always possible to self isolate without affecting others, especially if we live in multi generational households and overcrowded housing communities. Some health and safety risk assessments and equality impact assessments do not take into consideration our specific circumstances, and if they do, employers are responding to our individual needs and circumstances.
Can you speak up again, Thamisa? It's gone low again.
Including our risk to being disabled and or clinically vulnerable. Sorry about that. We are concerned, therefore, about the disparity of treatment in terms of being forced to return to on-site working without a full evaluation of our personal circumstances. The moral impact of decisions being made by senior management across the sector on our health and well-being is a concern to us, as we are finding that educational institutions are failing to take into consideration or to value how our work-life balance is adversely affected due to COVID. In conclusion, if we were to remove factors such as socio-economic status and our pre-existing health conditions, there is still a disparity when it comes to the impact of COVID on ethnicity.
Thamisa, I'm so sorry. Could you speak up again?
In conclusion, if we are to remove factors such as socio-economic status and or pre-existing health conditions, there is still a disparity when it comes to the impact of COVID on ethnicity and health and safety at work. While there is substantive evidence suggesting that factors contribute to this disparity,
Okay, I think we're losing Thamisa and her internet. Can you try? I'm not sure, Thamisa.
can you hear me?
No, can't hear you very well.
Can you hear me now?
Yes, yes. Do the last couple of sentences, please.
So in conclusion, if we were to remove factors such as our socio-economic status and our pre-existing health conditions, there is still a disparity when it comes to the impact of COVID on ethnicity and health and safety at work. While there is substantive evidence suggesting that many factors contribute to this disparity, the onus is on our employers to take proactive steps to prevent further discrimination and hardship for all Black workers. Thank you.
Okay, thank you so much, Thamisa, and especially to continue when you're struggling with some of the internet issues. We'll bring Thamisa back on again after we've introduced the other guests. Thank you, Thamisa. Really appreciate that, and I'm sure we'll come back to you in a moment when we answer some of the questions. Thank you so much. Elaine, I'm going to now move on to Elaine. Elaine. Hi, Elaine Huffman. How are you?
Hi.
So I'm going to come to you, and I'm going to give you 5 minutes. If, for example, you have any issues with your internet, and just watch me on the screen, and I will wave to you so you can see that we can't hear you. Okay.
Thanks. I hope you can. So I'm Elaine Huffman. I'm Chair of Disabled Members. I'm going to follow from our brilliant Vice Chair and probably repeat some of the things that she's said, but I want to start with a reminder that one of the very first things that happened in the pandemic was that the rights of disabled people were removed in the emergency legislation, including the right to the equal chance of a right to life, and including the possibility, particularly for Black people living in mental distress, of being sectioned by only one doctor, with everything that contains in terms of racial discrimination, racism. So things have been difficult, and we know that 2/3 of the deaths of people in COVID were disabled people, which is a figure way in excess of the prevalence in society that we have, which is about 16%. We know that Black people have an utterly horrendous excess death rate in COVID, so far in excess of white people. More than double the deaths would have occurred had white people died at the same level as Black people. That is an incredible and dreadful statistic, I think. And these two things, these two excess deaths, are connected. They're connected in a number of ways. Of course, first of all, these are the same people often. People are both Black and disabled because precisely of the way in which generational trauma and generational oppression and discrimination, economic inequality, which goes along with that generational discrimination, impacts people's health. You are simply more likely to be born disabled or to acquire a disability if you are a person who is black. It's a black person in our society that is so racist. It's also true of women, more likely to acquire disability and so on. Oppression and disability go together. We see it with our trans brothers and sisters as well, in terms of the excess suicide rate. Over and over again, we see how oppression and ill health, long-term ill health conditions or mental distress go together. So COVID in some ways has laid bare the intersection of ableism, which operates in our society, whether that's the economic poverty, the way in which we are more likely to lose our jobs if we're disabled, or whether it was the decision to take away the rights that we currently have, to lower them to independent living support and care from our local authorities, or the pandemic ethics of the medical profession that simply sent out do not resuscitate notices to people on the autistic spectrum, people with Down syndrome, etc. So that intersection is very, very clear, I think, now for everyone that wants to see it. And we see it clearly inside of our own workplaces in the universities and colleges, where our professors and our senior managers are still most likely to be white enabled men. Still a situation where the more junior academics and PhD teachers in the universities, who are more likely to be people who have not found their way into the structures because of structural racism and structural ableism, are more likely to be shoved into the front line of teaching now, with all of the risk that that entails to health, or are more likely to be the casualised workers who are both being shoved into the front line of teaching, but also being made redundant, particularly over the summer, in massive numbers. So I want to just try not to repeat the points that we made, but try and say something about what the issues are that we're facing now. Firstly, being sent back into the physical workplace without individual and carefully assessed risk. This affects everyone, of course, but it massively impacts disabled members who may have no demonstrable excess risk, i.e. they might be living with anxiety that makes a safe return impossible. And at an intersectional level, it may well impact our Black members very much more, not even for the reasons that have already been given, but for the reason of the hidden impairment that exists inside of a racist society. People may not even have the same, and don't have the same, access to health is a postcode lottery. Access to health is a wealth lottery in this society. And therefore we know that the structural oppression means that very often Black people are less likely to seek the proper help because they know they won't receive it, or are less likely when they go to the doctors not to be diagnosed. And therefore we have a situation where people may not have any evidence to give. They may not be able to know that they are at greater risk, but are being sent back into the workplace and relying only on the risk assessment that exists at the level of race and not at the level of impairment and disability. People who are Black are, as Thamisa said, less likely even to disclose a hidden impairment. But to be honest, disabled people of all ethnicities are unlikely to declare an impairment that they can hide. There is research on this at every level, from chief executives down. People hide impairment because we know what ableist attitudes mean. And we know that we are considered to be lazier, to do less work, to cost more, to have more time off sick. And therefore, quite often people are not getting those individual risk assessments that need to be had. And on a London level, you know, one of our most beloved and strong union members, Indira Sen, died from COVID. He had an underlying health condition that he didn't know he had. That is a reality for people. So there's that. There's secondly, the lack of reasonable adjustments that we had both at home and that we have being sent back into the physical workplace means that it's difficult to do our work without excess stress, physical pain, or being subject to competency disciplinaries. Those are happening. I'm hearing about that from disabled members every week now in our disabled members tea break chats. Time and time again, adjustments are being refused, and branches are overwhelmed and not really campaigning at that branch level quite often. And in both FE and HE, people are saying that they have to reapply every year, that it takes time to get them. And often they're not refused, they are simply not given for year upon year upon year. And this creates an absolutely impossible situation that we need to resist. The kind of, I call it the COVID okie dokie, this in and out that we have now, where students are being sent back into the classroom and teachers to teach them and other staff in the universities and colleges to service that. And then the students are testing positive, some of them, and then there's an out again, and then there's a hybrid teaching. It's impossible for people. It's creating a massive level of stress. The horror of trying to teach in class and manage the sensory overload of the chat that's coming in from the students who are not physically present, and the students who are physically present trying to integrate those things as well. It's impossible for people. It's creating anxiety and difficulty for absolutely everybody. Absolutely everybody, and that's why we need a general health and safety approach, but it creates excess and specific difficulty for people who, for example, have a reason why they cannot manage sensory overload, for people who are anxious. And we need to actually recognise the real harm of disability discrimination that takes place when our institutions are making this happen and trying to take an individual approach only to those who have declared and a strong enough feeling about this to stand up, because we recognise that oppression means a lack of power. And for us, I'm going to kind of finish on this really. There are other issues in terms of people being selected for redundancy, people being made to work, people who are recognised as not having to go into work face to face, but who are suddenly excluded from half of what's happening in their teams, which makes them more likely to be made redundant down the line because the chats are happening in the corridors or in meetings that they aren't in. There are many different things. And the fear of redundancy does make it difficult for people to speak up. But I wanted to kind of say that we need not a one-size-fits-all approach inside of the union, but we need something else as well. We need to recognise that if structural oppression is creating excess death, and we are where we are in the workplaces because of the way in which structural oppression and power impact together, then we have to talk as a union about where is our power going to come back to push back against that. Two things. We need all this legalistic stuff. We really need it to understand the law, to use it, to do the individual casework. But we desperately have to make this a collective question of power inside of the workplaces. Our bosses are going to kill us one by one, actually, and spread distress and growing disability, particularly mental distress, amongst our members unless we push back in terms of discovering our power. That's me done.
Elaine, thank you very much for that comprehensive introduction to who you are. Thank you. I really appreciate that. And we're going to have more from Elaine, Alex, and Thamisa once we've finished and we've heard from Maxine. I'm going to now introduce Maxine. Thank you, Elaine. I'm going to introduce Maxine now. Maxine, and welcome. Maxine, you have a few minutes to introduce yourself. So if I say to you, you've got three minutes to introduce yourself, and I will just give you a 1 minute after that. Thank you, Maxine. You're mute.
Victoria, and thank you to the previous speakers. Coming on after three speakers means that there's very little left to say, because most of the points that are pertinent and important have already been covered. Just want to say a little bit about myself. My name is Maxine Luby, and I'm a branch organiser. I also sit on the Black Members Standing Committee and the National Executive Committee for UCU. I'm also a health and safety rep, and I think that's one of the most important roles we as union activists hold. I've been working in further education for quite a while now. And with COVID, with the onset of COVID, obviously there have been a number of issues that have been thrown up. It's not something I share very often because it's very personal to me. And people who have a disability will also understand on hearing this why it's difficult to share your particular situation. I have a disability, what's considered an invisible disability, which has its own challenges in a way. For a start, it's very difficult to get people to understand how that disability impacts you on a daily basis and the impact it has on you within the working environment. As a Black person as well, as we know, there are concerns around COVID and the impact on Black people. And whether that's socio-economic or not, the fact is we know that Black people are dying at disproportionate levels and numbers compared to white people, and it's something that we have to think about and consider in all that we do. I think one of the problems we may have in universities and colleges is that race is a very sensitive issue to tackle for many, as is disability. So when you put those two things together, it may prove very difficult for some people to have that conversation with their line manager or even senior management. And at the same time, I also think that some senior managers in HR have a difficulty addressing those issues. And they're down to a number of reasons. One of those is structural racism. People only tend to deal with what they feel comfortable with. People that tend to only approach issues that they feel that they can, that they have the experience of handling or feel that they know they can support. Now, as a Black worker and considered disabled, I have had to put myself out there and question what's in place to support not just myself, but other people who find themselves in the same predicament as me, having underlying conditions, a disability, and being Black. And even for me, that was challenging. And I know it was challenging on the other side as well. But it's something that we have to do. We have to support those individuals who find that they're in a position where not only is their ability to function on a daily basis being brought into account, but the fact that we have a global pandemic that's killing people at disproportionate levels. And it's difficult, I do understand that, but it's something that we have to challenge. And we also know that disproportionate numbers of frontline workers have died from COVID. Now, we all know that teaching and lecturing is a frontline job. And even though the government has made it clear that people should have relevant PPE and social distancing should be in place, we know and we can see from our colleges and universities that constantly, week in, week out, those numbers are going up. If those numbers are going up, that's putting workers at even more risk. That's putting workers who may have compromised immune systems at further risk. That's putting disabled workers at further risk. That's putting Black workers at further risk. And I don't think that's being considered sufficiently. And it's something that we as a union need to tackle, which we are doing, I do know that. We as a union, we need to tackle and push back against. On top of that, if you are in a casualised contract, which many Black workers are, there are the issues about being seen to be putting yourself out there and requesting what some may consider more support, even though you're entitled to have that support. So when you are in a position of not being a permanent member of staff, being Black, being disabled, and then you're saying that you require support or you're requesting a risk assessment, that can be quite a daunting task for any individual. And it's something that we need to think about more seriously about how we support members to do that, because that again is putting you out there. It's putting you out there. Quite often people see as if you do that, you could be considered a troublemaker or expecting too much or unsatisfied with what you're given, and that should not be the case. In terms of equality, everybody should have the right to get the support they need to enable them to do their job effectively. And what I find we need to do or should be doing more of is demanding that colleges and universities carry out quality impact assessments, because that will inform them of what those particular communities, what those students need, what the staff members need, to enable them to carry out their job effectively and in line with equality standards. And unless we push for those equality impact assessments to be carried out, we're going to have a situation where people are not going to come forward and request risk assessments because they're Black and because they're disabled and meander along, which then puts them at risk and in turn puts their families and people they live with at risk. So there are a number of things that we really need to get on top of and tackle. And as I said, it's addressing those hidden disabilities. It's making people aware of the anxiety and stress that Black people in particular feel because of COVID. It's addressing the fact that people have financial worries who are on casual contracts, and supporting our members to raise those issues and push forward for change. Thank you, Victoria.
Okay, thank you very much, everybody. I mean, everybody's been able to give a really full introduction to themselves, which helps with the framing of the next part of the webinar. So I'm going to now ask questions to each of our panel members, and I think it might be useful to bring the panel members back on again, all of you. You've done fantastically so far, so I'm sure that the audience are really getting a lot of information. So the questions will be on screen, and I'm going to start off with Maxine. So I'm going to ask Maxine a question, which is, what should branches be doing to address the concerns of Black and disabled staff in relation to their health and safety? Now, Maxine, because of the time, I'm going to give you 2 minutes to address that question. Thank you very much.
No problem. I always say that issues around race and disability are considered very sensitive, as we know, and where they don't need to be addressed, they won't be addressed. And we should be addressing those issues in isolation as individuals. We need to be addressing those issues collectively. I would say, as a starting point, as branch organisers and members, you start with your regional office. You can get support and advice from your regional office in terms of what steps you need to take to get the support you need. As I said earlier, I think what's also really important is trying to get senior managers to sign up to and work with you to produce an equality impact assessment. Until universities and colleges have a clear understanding of what the issues are within their establishments, they will not be able to support staff fairly and equally. A quality impact assessment will look at all those issues. It will look at the makeup of staff. It will look at gender. It will look at the communities within which we work and live. It will look at how many staff may have disabilities. It may look at issues around childcare responsibilities, all those things. But until universities and colleges make a commitment to not just saying we are an equal opportunities employer and having that on paper, but asking those pertinent questions about what's our staff makeup, where do we work, what are the needs of our staff, what are the needs of our students, what can we do to better support them, then we're going to have this problem of people feeling isolated and unable to approach the issues of disability and race, particularly in this time of COVID, where we know those two issues are very pertinent and are a concern for a lot of disabled and Black members.
Thank you very much, Maxine. That's really helpful. I'm going to very briefly bring in Alex. Alex, you've got a minute to say what you need to say, and then I'm going to move on to the next question.
Okay. Well, I'll just add to what Maxine said in that case. I mean, you know, the issues are not new, and COVID exposed these long-standing inequalities that we're already aware of. But it's a real opportunity now, I think, to tackle a lot of these issues through health and safety routes and health and safety legislation. So, you know, speaking to your disabled staff, your Black members, or the staff in various different equality groups, and to really capture what the barriers are that are being faced and the types of discrimination, so that you can embed that within the risk assessments and collectivise the issues. And as Maxine said, you know, you need to organise and campaign on those issues and get the workforce involved as well. It's really important that, you know, we hold the employers account under the health and safety legislation. They have to take protective and preventative measures to protect all staff. And if you don't draw their attention to the hazards and risks that are facing particular groups of staff, then they are under no obligation to do anything, because they could say, well, we weren't aware, you know, we weren't aware of these particular hazards or our role in that. And so you see employers trying to individualise the issues quite a lot. And so as a union, your role is to collectivise those issues as much as possible for all the reasons that have already been discussed. Ensure that the risk assessment approach is up to standard, that they're conducted by competent persons, and that this is all done in consultation with the trade union. And if your local branch doesn't have that level of knowledge or expertise around equality or health and safety, then that's when you should really be involved in your regional office and national and elected officers, such as the ones that are present today, for further advice and guidance, because it is available and we can produce more as is needed. So I think I'll leave it there.
Thank you very much, Alex. I'll hear more from Alex hopefully later on. So I'm going to move on to the next question, where it's going to Elaine. Elaine, you're going to answer this question, so I really appreciate that. It will be on the screen. I'm just going to read it out very quickly. What can we as neurodiverse lecturers or tutors do when we are being asked to work simultaneously online and in person, despite the fact our differences mean that this can trigger information overload, affecting our ability to teach at all? This is a particular problem for those who have ASD and students with ASD or ADHD who can struggle with the disruption and range of inputs. Elaine, I'll leave you with that question.
So, yes, and can I add, I think it's also a particular problem for people who have other ways in which they are overloaded and overwhelmed. I don't have it as a neurodiverse issue. I have it because I get very anxious sometimes, and because I've had some TIAs and my brain literally can no longer just take everything in. So it's a difficult question for many of us. And I think the question has been partially answered by the answers just given by Maxine and Alex in terms of individual risk assessment and the equality impact assessments, and those being done well. I would say two things. I don't think that it should be down to our disabled members to do everything about it, but what can be done as individuals is to talk to your union branch about declaring if you haven't done so, to ask for the individual risk assessments often through a caseworker or for yourself, but make sure that the union equality officer and caseworkers know what's going on and are kept up to date with those things. We can do those things as individuals. Of course, we can refuse. When we feel strong enough, we just don't do the things that harm us. But very often in workplaces, disabled members are being made to do things that harm us because of this question of power. So I want to say something else. I don't think this should be happening at an individual level, actually. Although the law on the Equality Act and the Reasonable Adjustment Law is very individualised, I think we need to think how to collectivise it. So I think every branch should be asking that every single person teaching in this dual blended way is given an individual risk assessment, because in that way people who haven't declared are caught in the assessment and have a chance to ask for it. It becomes mainstreamed, and that's what we mean about social model. So all branches should be asking for everyone to have an individual assessment of that. I think in terms of collectivising it, we also need to think very carefully about how that then becomes an issue. We need one of the things that as disabled members we can do, and it's been hard in the years that I've been in the union sometimes, is educate the rest of the union about ableism and make people understand what we need. Disabled members actually wrote to the General Secretary to ask for for individual templates around the Equality Act that we could individualise for each of us alongside of the health and safety risk assessments, because we are aware that we're not all captured in the generalised health and safety stuff. So we can educate people and we can demand what we need. The last thing you do is take a motion to your branch meeting, speak to your branch officers and insist on some kind of collectivised action that says we all need this assessment. None of us should be doing blended learning. Not one person should be doing something that is difficult for them or that increases mental distress, overwhelm, risks our health and so on. So collective and individual with specific steps. But come to our tea break and talk more about it.
Thank you very much, Elaine. Thank you. That's really, really helpful. Really, really comprehensive answer. I'm going to now swiftly move on to Thamisa. Thamisa, I'm going to, I would like you to answer the next question, if I may, which is, what is UCU doing to ensure disabled members get their reasonable adjustments?
Thanks, Victoria. I hope you can all hear me better now. I've switched my mic, so
We
let's see
can
how
hear
that works.
We
Okay,
can.
so for me, that question would be, I would ask that question as, what are we doing? You know, I see UKU as the members, we the members, because we make up UKU, and therefore I think we have an individual responsibility to ensure that access and reasonable adjustments is not a barrier, really. So my understanding is that UKU forges alliances with disabled organizations, and they continue to develop guidance on establishing and maintaining diverse, inclusive working environments for people with disabilities. I know that UKU has policy and resources to guide and support branches with their negotiations with employers. Can't hear me.
If you can come forward, move forward again. That's what helped last time.
Are you hearing me now?
Yes.
All right, sorry. Yeah, so what I was saying is that UKU has policy and resources to guide and support branches with their negotiations with employers. So it's really about what we are doing as members to ensure that we have the support we need. Some of these resources that I know are available to us to ensure that branches can negotiate effectively on members' behalf and create diverse toolkits, the reasonable adjustment first.
Okay. We're gonna leave Thamisa because we can't quite catch her, but we'll catch up with her again in a moment.
Right.
I'm gonna move on to Elaine, and I'm gonna ask Elaine the next question, which is, what rights does the law give us to get reasonable adjustments in COVID?
Fortunately, one law that the horrid government we live under, the Tories, have not yet managed to dismantle, while they were dismantling other bits of disabled people's rights in the pandemic legislation, is the Equality Act. And actually, there is no change under COVID than there was before. What we have got, I think, is employers who are even less willing to put resources in, but legally we have exactly the same rights as we had before under the Equality Act. So I'll just quickly run through the right to reasonable adjustment, and when I forget, Alex can come in and help if she's willing to. But under Section 20 of the Equality Act, we have a right to ask for reasonable adjustments. When I do it, and when I help anyone to do it, I always quote the section of the Act, and I always ask for a response that actually says why it is not reasonable to provide these adjustments under that Act, and a timescale to do it in, because that's helpful. You can use our disabled members' passport that is on the website to actually sort of write down. It structures it actually and helps you to know what to write. So you have the right, if you are disabled, which is really somebody who lives with physical or sensory impairment, long-term health conditions, lives in mental distress, and of course it includes the deaf community, people with visual impairment and so on. So if you have an impairment that is considered to be long-term, which means it doesn't mean, as many employers like to pretend, that you have to have had this ill health condition or impairment for 12 months. It means it is likely to last for 12 months or more. And it has to have what's called a significant impact on your daily life. So when you're asking for adjustments, it's good to list the impact of your impairment upon how you function. It's a horrible thing to do, actually. And I've spoken with some BUT members who felt that individualising is a really horrible way of denying what people's oppression is and putting it on them rather than on the employer. But that's how the law works. So you need to ask for what adjustments you need. And if they, and branches need to keep a very careful, caseworkers and us need to keep a very careful eye on the timescales, because often employers will simply not answer the requests. They will never provide you with a written response, or they will never put the things in, and they'll just keep discussing it and going on. And we need to know when our right to take them to court kicks in, which is 3 months minus 1 day from a refusal. There is also a possibility of taking them to court to the employment courts if they do not give you an adjustment quick enough. So those rights exist. But we also, I think, in COVID, things are getting pushed to the side. The ableism means that we are just not considered that important. It's considered normal that we're dying, actually. It's not thought it's about care homes and about whether or not people get equal access to treatment. It's just considered like we're supposed to die. All our rights are being kind of pushed to one side. So I think it's going to be important that we collectivise it. One of the things we did in Hackney when I worked there was had a protest about reasonable adjustments, naming specific things the college hadn't done. We can do those kind of things. They can be done online. We can have a big push on the day of action and the week of action around disabled members that's coming up. So, sorry, that was a bit long, but I'd suggest those things.
Thank you, Elaine. That's really great. Don't need to apologise. I'm now going to move on to another question, which I would like Maxine to start off with, and then I'm going to bring Thamisa in. So, Maxine, why is disability seen as an extra burden to employers?
Okay, thanks, Victoria. It shouldn't be, but whoever sent that question, it's a really valid question. And I would say one of the reasons why some employers, I won't say all, but some employers may see it as an extra burden is that they know as part of the Equality Act, there's certain duties they have as an employer that they have to carry out. With that in mind, that will possibly entail them having to carry out reasonable adjustments, working with individual members of staff who require those reasonable adjustments to ensure that they're in. And I think one of the big things is that once an employer understands that they have to support individual disabled staff, they also understand that there may be a cost implication associated with that. And that could be in terms of resources. It could be in terms of staffing. It could be in terms of bringing in some extra kind of resource to support that individual. And also on top of that, it's about ensuring that all the paperwork that's required is complete. And anything to do with paperwork and law and HR, sometimes they don't go well together. So it shouldn't be a burden, but I can understand the question as why is it seen as a burden, because it's something that has to be done, and it has to be done properly to ensure those individual disabled workers are getting the support that they're due by law. And I think that's why it's seen as a burden. And also they get it wrong. Like Elaine was saying previously, they get it wrong and they don't support disabled workers in line with legislation. Then they could find themselves in a position where individuals take legal action. So I think that's why it's at times seen as a burden.
Thank you very much, Maxine. Thamisa, is there anything you'd like to add to what Maxine just said? Can you put anything on the chat?
Can I add something very quickly while we're waiting for Thamisa to do that?
No, yeah.
It's just ableism.
Yeah, Elaine.
It's prejudice. That's why they see us as a burden. It's straightforward, prejudiced notions about us.
Yeah.
Okay. Alex, is there anything you'd like to add at all?
Yeah, I mean, I was just going to make the obvious point, I suppose, that Elaine made, which is just that, society, our structures, everything's being developed for non-disabled people. And so we're essentially asking employers to unpick that and, start again and consider disabled people. And that is costly and takes time and thought. But employers also don't understand, I think, as well, the nature of the barriers faced by disabled people. And some of the measures they can take are actually not costly, and they are easy to do, and they are effective, but there's just no will. And that's why the Union and the Equality Act exists.
Thank you. And Thamisa, thank you so much. And also a point here from Thamisa, which is it's a structural burden which goes against the norm. It's a structural burden which goes against the normal. And that's really, really powerful. I am going to end on one last question, and then I'm going to ask all of you to just say something to close as a closing statement when it comes to it. My last question is going to go to Alex. Why is UCU staff acting as gatekeepers when we are involved in discussions on race and disability?
Yeah, I mean, obviously, I don't know the context of that question and whether there's this particular example there. But UCU, obviously, we are all the union. We shouldn't be acting as gatekeepers in any way to information or support for members within the union. So it's just really important that we all work together, I think, to promote equality and to tackle all the issues that are coming up around COVID. And there is a lot of crossover between health and safety and equality, and so it's important that we try and get access to information out there as quickly as possible. And we do have structures in place. I would just say if you feel that that's the case, you need to raise it with your branch, your regional offices and so on, so that we can understand what the issue is.
Thank you so much, Alex. Really appreciate that. And I really want to say thank you to everybody else. So I'm going to start with all of you, and I'm going to go around the room and just ask you to just say something to sum up for a minute or less. I would like to start with, I'm going to do in the same order. I'm going to start with Alex.
Okay, I suppose rather than a summary of what I've already said, I'd just add that there is, a difference between reasonable adjustments under the Equality Act and control measures in risk assessments. And obviously, you need to understand that if you're a branch rep, and you need to understand that if you're a member who's affected by these issues. And I think you can ask for reasonable adjustments under the Equality Act, as well as controls to any health and safety risks that you face within the workplace. And that can sometimes cross over. There might be similar things that are reasonable adjustments and similar things that manage risk, but both should be in existence, and both mean very different things. And it's much easier to collectivize health and safety control measures in a risk assessment than it is to collectivize individual reasonable adjustments, which are catered to the individual needs of that person and the barriers they face within their particular workplace and so on. So it's really important to distinguish between the two and to use them to their greatest effect in collective bargaining.
Thank you very much, Alex. I'm now going to move on to Thamisa. Thamisa, is there something you would like to finish off with?
Muted.
You're on mute. You're on mute.
Can you hear me now?
Wonderful.
Right. I was just saying that I put it in the chat just in case you can't hear me. But I just wanted to add that UCU has very good resources to support its members. And I know that there are times when we feel overwhelmed when we ask our branches questions or we ask for support and they are not responsive. And it could be that, the truth is we don't know everything. And we have to engage in a process to support each other. So it's still an individual responsibility. And I think the onus is still on us as members of UCU, because it's 4 members, that we engage in active collective action so that we could support it moving forward in terms of getting adjustments and ensuring that all our needs are met by our employers.
Thank you, Thamisa. That was really helpful. Thank you very much. Elaine, I'm going to move on to you next.
I want to come back again to that question about why do they see us as a burden, and it is to do with the fact that structural and economic oppression exists at a societal level. It simply is it's a massive waste of human resources to exclude people on the grounds of either racism or ableism, but it happens all the time. And at an individual level, in terms of ableism, it's what we see from our employers. It's how that structural oppression relates itself. They believe that we are lazy and expensive and will take time off sick and will be more of a burden. Actually, we do the opposite most of the time. But I think, I slightly disagree with Alex, actually. I think they knowingly do that. I think that they are conscious that actually by putting that pressure on people, they get extra work out of us and achieve more than they should from us. And we, I think, have to see COVID, the horror of COVID, as an opportunity to change, because we cannot go on the way things are. We have to pluck our courage as a movement, actually, in the same way that all those amazing young, particularly young Black people did in the Black Lives Matter protests. I think we have to push this forward. We have nothing to lose by uniting together, organising together in solidarity and in active resistance. And we have everything, literally our lives, to lose by not doing it. So let's see what we can do to be braver, to take the example of the young people in the Black Lives Matter movement and push for change, demand it and make it happen.
Thank you very much, Elaine. Really appreciate that. And finally, Maxine.
Yes, hi, thank you. I think what's really important, and it's something that I've been made aware of, particularly with the situation that we're in with COVID, is I think we need, as a union, we need to do more to support individuals so they're not in a position where they're having to go into their line manager or HR and request. You know, nobody should be in that position where they feel isolated and unsupported, and they're asking for what's their basic human and equality rights. And that's what's happening with a lot of members. They're having to take it upon themselves to make that request in isolation on their own with little or no support. And we need to find mechanisms as a union to identify Black members and Black disabled members and all those intersections, identify them and support them through those challenges, because it's hard enough being Black, it's hard enough being disabled, it's hard enough being both of those things without having to, as an individual, go in and demand your rights, particularly when you're possibly on a casualised contract and you're not in secure employment. All those things tend to go against you. So we need to collectivise as a union and find ways to support individuals so that they don't have to do that on their own anymore. Thank you.
Thank you very much. That was wonderful. I just want to say thank you for all what you've done for the panelists. Even overcoming the internet and how that lets us down, it is something which we do have to deal with every day when it comes to trying to do something online. I think the last thing I want to say as well, what we didn't mention, is also people which have caring responsibilities, where they've got people which have got disabilities. They may not have the disability themselves, but they're caring for them. And I think that's something we also need to include. And if you want any resources, there you will have an opportunity to tap into the resources that will be online. So you should be, after this, you can actually see the list of resources which are available. If you need any support, additional support, or getting involved with UCU's disability committee, members standing committee, please do contact the chair of the committee, and also the person who is our official, which is Sharon. I'm sure she'll put her email address, and so you can see that. Okay, thank you very much, and please enjoy the rest of your afternoon.
Thanks, everyone.
Please, can you stay on, the rest of you?